And we're only going to record the presentation. When we get to the discussion, we're going to turn off the recording so that we can be open and so forth. But I did want to say that.
Uh-oh, we lost Lucy. All right, well, I can pick it up from here. So welcome everyone. We are very excited to be here. We want this to be an open session. So the way we've structured it, we'll all start off with introducing ourselves. We have a magnificent panelist, and my co-presenter Sharu is here. And so we'll start off with introductions, and then we'll do a brief introduction. We have some slides about the topic. And then we're going to open it up for discussion with our two panelists who you'll meet in a second. But we do want to say that we really do want this to be an open discussion. We recognize that this is an opportunity for us to learn, to grow. Sponsorship is almost like a quality improvement project if you think about how underutilized it is around the campus. So with that said, I'll introduce myself. I'm Angie Ellison. I am currently the Vice Chair of the Department of Pediatrics here at CHOP. I think of all the hats that I wear, the one that I'm most proud of is being a mentor and a sponsor for faculty and trainees, and particularly the women and those who are underrepresented in medicine. So I'm going to pass off to Sharu, and then you can pass off to Jess and Edie Miller.
Hi, everyone. Thanks so much, Angie. And I have to, just take a minute to acknowledge Focus for really taking on this issue of sponsorship, which may be very distinct from mentorship, and giving us an opportunity to discuss this in forums and webinars such as this. Extremely happy to be here with Angie, who I've collaborated with previously on this topic. As well as Jessica and Heidi, who will introduce themselves. Thanks, Lucy, for again for having us. By way of introduction, I'm Charu Agarwal. I am the section chief for thoracic and head and neck malignancies within the Division of Hematology Oncology. I'm an associate professor of medicine. And I am on the CE track. I see patients, I run clinical trials, and I perform research. But I think, as Angie said, one of the things that I'm really passionate about is being able to mentor. And in my limited capacity, or I think in my capacity, as many of us can recognize, being able to sponsor people who may be junior to me, but importantly, advancing women faculty and their careers. So with that, I'll pass it off to maybe Heidi, to you first.
Well, thank you so much, Sharon and Angie, and thank you for inviting me to attend again today. So I am a professor of clinical ophthalmology. So on the AC track, and I've been at Penn for a little over 20 years. I am also director of the glaucoma service and vice chair for faculty affairs within my department. And just this past summer, took on the role of chair of the Committee on Appointment and Promotions for the academic clinician and clinical track. So that's a new role for me, which has been quite exciting. And I think it's an opportunity to really see what the results of strong mentorship and sponsorship have been in terms of faculty who are going up for promotion, and also just to kind of give some insight into what additional opportunities we should be pushing forward for all of our women and URI women here. And so it's great to be here, and thank you for inviting me to be part of this group.
My name is Jessica Fowler. I am an assistant professor of clinical anesthesia and critical care, a pediatric intensivist over on the CHOP side, and very excited to be here. A couple different hats really around work focused on diversity, equity, inclusion, both on the CHOP and Penn side. Have a leadership role within GME at CHOP, and then I'm one of the faculty co-leads for the Penn Medicine CHOP Alliance of Minority Physicians, and really excited. I feel like I've been a huge beneficiary of sponsorship, and also probably bring a lens that the group that I'm often focused on making space for are our trainees. And so really excited for the discussion today. I'm glad to answer questions and just engage in topics that I think will can make a huge difference for how we continue to influence the culture and the opportunities, particularly for women and women of color here at Penn.
Thanks. All right, Trevor, you want to kick off the slides?
Absolutely, I'm going to share. Right. Can everybody see my screen? Since I have more than one screen in my office, sometimes it
We can
Yes.
see. Yeah.
you can see. Okay. So as many of you know, the topic for today is sponsorship, and these are slides that Angie and I have put together earlier. Would love to walk through these with you. Again, this is not meant to be a didactic lecture by any means, ways, or sorts, but really just to highlight some of the ideas around sponsorship and in an effort to create awareness. So just by way of show of hands, or you can raise hands on the Zoom screen, how many of you currently have one or more sponsors?
Sorry to interrupt, Trevor. Are you able to put it on
Presenter mode?
their mode? Sorry.
Oh, it's not on presenter mode?
No.
Okay, so I'm not sharing my proper screen. Hang on. I'm going to exit.
I won't read out the chat. Well, someone said
Give me 1 second. I'm going
normal.
to
Jess says 1 formal and 2 to 3 informal. I'm interested in knowing the difference between formal versus informal. Yes. Most people have at least one. Yeah. 2, she.
Yeah, I guess my question too, oh, I'm sorry. Is this okay to interject here about this question?
Sure.
Yeah,
Hi, I'm
absolutely.
Chichi.
We're
I'm Chichi.
experiencing technical difficulties anyway, so yes,
Oh,
perfect timing.
Hi, I'm Chichi Kagani. I'm a child psychiatrist at CHOP. I guess I'm also curious too, in terms of like sometimes I didn't know I had a sponsor until someone mentioned to me that, someone talked about you. So I find that also interesting. I thought I only had one, but then later I'm like, oh, I have a second person. So that's
Yeah.
also an interesting dynamic there.
And it's such a treat when you find that out too.
Yes.
We're going to talk about that a little bit. So Sharu, maybe we'll just go on. It's fine. We can just.
I'm sorry. It's because of the multiple screens that I'm unable to do that. So maybe we'll just go with this. It's not too many slides.
Yeah.
Okay. All right. Now let me advance. Okay. Can you see it still?
Yes.
Okay. So we just wanted to talk about sponsorship for a brief minute. And this is distinct from mentorship because we know that sponsorship is the public support by a powerful, influential person. This may be in an organization or in academic medicine, for example, for the sole purpose of advancement and promotion of an individual for whom he or she sees untapped or unappreciated potential. This is distinct from mentorship because mentorship, while can prepare to move people up, sponsorship makes it happen. And this, I think, is a very important quote because as we move up in our careers, sometimes you always need mentors, but I think sometimes sponsorship may be slightly more important than mentorship. And these are some of the differences between mentors and sponsors. And, when we think about it from a broad 10,000-foot view, we know that mentors have mentees, but sponsors have proteges. Mentors can be anywhere in the hierarchy, but usually sponsors have a position of power or have some kind of authority or influence. And I think this is the word influence that's most important here for a sponsor to stick their neck out and really advocate publicly for the sponsoree. So while mentors will speak with you, advise privately, give you perspective, advice, feedback, help craft a career vision, I think the role of sponsors is actually slightly different. They may not be people that we meet with on a one-on-one basis, but given their position and their role, they may actually advocate publicly, speak about you, as well as drive the career vision. Again, providing exposure to other people in the organization. And then mentors can do a lot of sort of day-to-day problem solving in terms of offering empathy, offering advice about navigating politics within the organization, providing support. But sponsors usually, as is the usual definition, may have you at an arm's length, may know about you in a broader scale or broader image picture, but may not be so intrinsically intertwined with day-to-day affairs. Of course, we have a lot of examples of both mentorship and sponsorship, that mentors can also can also serve as sponsors. So of course, this is not completely 100% true. And it's not always in isolation. But if you were to have a sponsor who's technically not a mentor, this is one way to think about differences. And then you can really see about inclusion and about the expectance of, what is the end goal here. Mentors really want tremendous success for their mentees, but they expect very little in return. So if a mentee is not performing, they have little to lose because they're not publicly sticking their neck out. But the sponsors, I think, do expect stellar performance. They expect loyalty, etc. We know that as is similar with mentorship, there are probably wider sponsorship disparities. So we know that women are over-mentored, they're under-sponsored relative to their male peers. Men are 45% more likely to have a sponsor compared to women. And then this is also true for disparities when you look at it with an angle of race. And then this has been shown, I think this is very, very true, that lack of sponsorship can directly lead to a lack of leadership. And you can see in academic medicine, by leadership as well as by women, as well as on the right side by underrepresented minorities. You can see how many of these may become deans. There's a huge disparity between men and women, as well as between underrepresented men and women across the years, so between 1993 and 2022. And I think this is a slide that speaks to many of us, and this is something that we want to place here because it's not just men, women. This is also about racial disparities. This is a very nice piece that was written by Dr. Blackstock, who very publicly actually left academic medicine. She's a very strong voice on Twitter and social media, and has been doing a lot of active work now that she's left academic medicine, I believe from Harvard, and one of the issues that I think she's cited is that there's just no clear organizational sponsorship, even though there may be mentorship opportunities. So here are the 4 ABCDs of sponsorship. Amplify, I think sponsors really amplify the sponsoree's achievements more so in a public setting. They can boost a protege's career by formally nominating them to opportunities, writing letters of recommendation, as well as attesting to the protege's future potential. They can make connections, sometimes in a very public fashion, making introductions, and then defending. And I think this is quite important, that a sponsor who has a position of authority can actually stand up and reverse or neutralize others' uncertainty or negative perceptions, which I think is probably one of the most important things that you can expect out of a sponsor, to actually stand up and defend you publicly. And as we were talking about earlier, this is a spectrum, and we're going to hear from ID and Jessica about how mentorship can also evolve into sponsorship, where mentorship is a very private relationship about advice, supporting, and coaching, and sponsorship is a much more public relationship. But as you can see, mentor can also be a strategizer. A sponsor can also be a door opener, and there can be sort of different sort of variations across this spectrum where a sponsor may fall. So with that brief introduction, I will stop sharing and would love to